Welcome to Marian Ayurveda. In this episode, we are going to discuss knee pain and shuttle games. Knee pain experienced by shuttle players. For shuttle players, their knees are a very important part of their body. Injuries to the knee can adversely affect their career in shuttle or even their ability to play the game itself. Welcome to this informative session. So in the sport of shuttle, the primary contributing factor for chronic knee pain is the various types of muscle-related injuries and strains that occur during active play. In this episode, we will be taking a detailed look at exactly how these muscle injuries happen, how you can accurately identify them, and the various ways they can be effectively treated. I am Dr. Anumod Kakkassery, practicing at the Marian Ayurveda Center, located in Thrissur. Today with me is Nixon. Nixon is someone who plays shuttle with us. So I met Nixon the other day while playing shuttle. He said that because of foot pain, he was unsure whether he should continue playing shuttle or not. So at that time, he came to our clinic, and could Nixon share his experience about that?
That is, we play together there and we play outside. But when this foot problem started, usually people tend to go after English medicine. But right there, we have our own board, the doctor's board. So when I mentioned this, I came here and checked my foot, holding it on both sides like this. And there, like this, there was an injury. But they checked it by holding it. After about 4 or 5 days, my knee pain was completely gone. When I say completely gone, now I'm playing shuttle, badminton. Back then, for about 1.5 to 2 weeks, I didn't play. And after I started playing again, it wasn't that bad for me. I don't do any other exercise. So like that, I only skipped it for about 4 or 5 days. So when I checked by holding it, on the 4th or 5th day, when I pressed on the same spot and checked to the side, there was no pain anymore. So from the next day onwards, I started playing again with confidence. Now it's been 2 weeks and I've been playing comfortably.
And about palpitations, right? Or the heart's pumping or any irregularities with the heartbeat, right?
After I mentioned the palpitations, we discussed whether it could be some issue with blood circulation. And they said it could be, so they gave me all this. They gave me something like a special herbal decoction for that. That made a huge difference. After I mentioned that there was a change earlier, after about 2 days, when I used to play games, I would feel a kind of palpitation. Now that has changed by about 80 to 100%. Now I feel energetic to play. Now I am 51 years old. Now when I got the same energy that I used to have when I played at the age of 25, 28 or 30, I feel that maybe it's because my muscles are in good condition, this treatment and the medication I'm taking now. That's what I think.
What we call muscle injury is a very important matter. Now, injuries to the shoulder muscles can completely take away our smashing power. Otherwise, shoulder injury, pain in the arm. There are people who stop playing shuttle because of arm pain when smashing. And similarly, we can't jump and hit if we have knee problems or muscle injuries, or we can't run. All these cause different kinds of problems for different people. So up to a certain extent, all these require only very simple treatments, nothing major. It's not expensive either. With these minor treatments, we can just come and get checked. And as Nixon mentioned earlier, we can tell just by touching the muscle. We can tell by touching each muscle. We can check each muscle to see if there is any injury to the muscle fiber anywhere. This muscle will have healed. Then it will be fine. We are that confident about it. This is not something that just started now. This is something we've been doing for quite a long time. Yes, mainly the muscle that causes knee pain for people who play shuttle is called the rectus femoris. That muscle starts from the upper part of the thigh and covers the patella and surrounding areas. Once that muscle gets injured, it becomes extremely difficult for us to even take steps. So it is the injuries to these muscles that are mainly responsible for knee pain. Now, if you're wondering how we can identify this, actually we ourselves can figure it out on our own. If we take some oil or something similar and press on our thigh muscles with our fingers, we'll notice that in certain spots there will be intense pain. This pain is due to muscle fiber contractions. The muscle is actually tightly contracted in that area. So when the muscle remains tightly contracted there, it puts pressure on the knee and causes severe pain whenever the knee moves. If this continues for a long time, it can eventually lead to joint degeneration. So if the muscles on the side, the back muscles, or any of the muscles around here are tight, that alone can cause knee pain. When knee pain occurs, the body's automatic response is to accumulate fluid in that area. This is the reaction that the body shows. It's like saying, don't play anymore. If you keep playing, it will lead to wear and tear or damage to the cartilage or even bone degeneration, and that's why fluid accumulates. So first, the muscle injury occurs. The muscle injury gradually leads to fluid accumulation. When both of these happen together, it results in pain, and then we won't be able to play anymore. Even if you do exercises or physiotherapy, these contractions that have developed in the muscle will not go away. It is only when we manually, with our hands, palpate the origin and insertion of the muscle, that is from the beginning to the end, and identify exactly where the muscle complaint is, and then manually correct it, that the muscle knot gets released and we are able to play comfortably again. So once we do this, there won't be any major issues. For those who play, there is a chance that this can happen from time to time, and it can occur in two ways. One is when we play without warming up the body, or sometimes abnormal movements can happen while playing shuttle. That's how injuries to the knee usually happen. So we can resolve this quite easily. It's nothing too difficult or serious. It doesn't require expensive treatments either. These muscle injuries are something we can handle very simply. We just need to use our hands, but we do need some anatomical knowledge. The doctor needs good experience and familiarity with this. We know that the muscles in the leg are the most complicated muscles. Some are straight, some run through the inside, and some are only on the side. In this way, the muscles of the thigh are arranged in many layers. For a doctor who is well versed in anatomy, this is a very simple matter. So in my opinion, to a certain extent, if the cartilage in the knee is not completely gone, we never have to stop playing shuttle because of knee pain. If we make sure to get the right and proper medical treatment for it immediately, we can definitely return to playing our favorite sports and activities very quickly. We truly look forward to being able to meet with all of you again in another upcoming episode very soon. Thank you so much for watching today, and please take care of yourselves until next time.